Right. So, Felix, let's talk about the TRT benefits versus the risks of starting it, and that for men who are really new to it.
Yeah, so obviously there's no medication that you can take that doesn't have risk. It's just about quantifying whether that risk is outweighed by the benefits that might be conveyed by taking the medicine. So I think for me, when it comes to risks with TRT, we're doing replacement. So and that's key, isn't it? We're not doing supplement. In fact, actually, there was a video with you and Gil just recently about this. It's not about supplementation. I really liked how he worded that. Why would you start to try and fix something that isn't broken? You're not going to top something up that is already optimal. So when we're talking about TRT and risks, this is replacement. So how is there going to be any risk to replacing someone to a normal physiological level where it's deficient with a bioidentical hormone? Like it makes no sense, because it's something that our bodies did produce, and for whatever reason they don't anymore. So the only real risks I think that come into TRT is when abuse occurs. Now, and that's the same with any medication. That's the same with oxycodone. That's the same with morphine. When they're used well, they can be used safely, albeit those are probably poor examples because they have high addictive properties. But because I've not met many people that have become addicted to testosterone. But there certainly can be a habitual addiction with things that perhaps can cross that border into performance enhancement. But I think when you're using it responsibly under the guidance of a professional who is experienced in that, and they are overseeing your treatment, there's very little risk to TRT if you need it. Now, I think the difficulties we have sometimes is where guys perhaps didn't need it, and they were in that sort of borderline range, and they perhaps had other stresses going on in life which they weren't acknowledging, but they were putting it all down to TRT, to testosterone deficiency. So that's what got them thinking I should try TRT. Now, those are the guys I think that don't tend to do well, and the risks can be a little bit not even higher. I don't like that word. The risks of it not working are probably higher. The actual clinical risk to causing them harm is still exactly the same. They're not going to be harmed by it, but they don't tend to be successful or stay on it because they technically didn't need it in the first place. And when they've got that sort of wisdom of retrospect and looking back, they're like, do you know what? When I came to see you, Felix, I just lost my house, I'd lost my wife, and that's probably why I felt the way I did. And it just so happened that I checked my levels at that time and they were low, so I pinned it all on that. Now, those are the guys where I think the risks are that it's not going to cause them clinical harm, but the risk is that it's not going to do positive things for them. So in terms of benefits, if you're clinically deficient, they're numerous. Like, so you're going to have a newfound sense of self. You're going to get that drive, that determination back where you'd lost it before. You're going to have an increased sense of well-being because there's a really, really close relationship with testosterone and the dopamine and serotonergic pathways. And I think that's key to talk about as well. Like, testosterone itself isn't a feel-good hormone. Like, this isn't what makes us feel good. It's something that allows us to have another process take place to make us feel good. So that interaction with the dopaminergic and serotonergic systems that testosterone facilitates is what makes us feel better. It's not so much the testosterone itself. Without getting too much into the physiology side of things on that one. So that's a bit of a rabbit hole, but and we'll get talking about the brain dopamine and everything. But it's an interesting subject. But yeah, that's certainly a great benefit that you'll see. You'll see improved energy levels, which often you tend to see especially men who were into exercising, especially resistance training in their younger years, start getting back into it because they wake up, they feel refreshed, their sleep improves, and their energy therefore improves. They get much better deep sleep. They start hitting the gym again. Their body habitus improves. They get increased lipolysis because they increase their HSL, their hormone sensitive lipase interaction. So they start getting increased lipolysis, so their fat breaks down quicker. That motivates them to be healthier, make better lifestyle choices. They stop drinking, they stop smoking. It's a no-brainer for me. Like the benefits far outweigh the risks when it's managed well and when it's required.
Yeah, sure thing. In our Facebook group, TRT and hormone optimization, almost every day I see several questions just like this. Can TRT be dangerous long term for your heart? Can it cause prostate cancer and so on? And we can always give the same answer. Will high normal testosterone levels cause heart problems, cause prostate cancer, and so on? How can you even be worried about that?
Yeah, exactly. And there's been studies on this, and these are actually published by the British Society of Sexual Medicine. So they've actually proved that healthy testosterone levels reduces mortality risk in terms of cardiovascular events. And the old legend of of prostate cancer being DHT hungry and being fed by DHT was debunked many years ago. So yeah, we can look to the evidence for things like that to reassure people that if you are managed well and you're not you're not abusing steroids and being super physiological all the time, then yeah, it's going to have very limited risks and maximal benefits for sure.
Mm-hmm. I've met several men in their 30s who are depressed, anxious, have libido issues, and so on, and they're prescribed by their GPs serotonin reuptake inhibitors, antidepressants, and so on. And even when they do blood testing and they have low testosterone, their GP just keeps them on the medication in contrast of starting them on TRT. And once they do start on TRT, I have convinced several of them to even try it and see a practitioner. And I have met several that started on TRT, and it opened up a whole different world. They could stop the antidepressants. They're much better now. They lost weight and so on.
Yeah, no, I've seen the same in my clinical practice, Stephen. Like they exactly identical examples as to what you've just said. And the ironic thing about starting someone on an SSRI just because and it's difficult again for GPs that have 6 to 8 minutes to see these guys. It can mirror depression quite well, being testosterone deficient.
Yeah.
But if you've had the forethought to test their testosterone and it shows low, you shouldn't be starting them on an SSRI, because interestingly enough, there is some growing evidence that antidepressants and SSRIs and monoxine MOAs, antidepressants can actually still push your testosterone levels down further. So you're actually doing more harm. If you've taken a testosterone and it's low and you still start them on an SSRI, then you are technically causing harm. And that's not something we should ever do. We should be trying to avoid that. And like you said, I've seen it myself. I've had people on high dose sertraline, so 200 milligrams a day, and I've seen them go from doing that and still not seeing many improvements in their life. Just a mild they describe it as a mild the pressure on the chest feeling being a little bit less, but otherwise unchanged. Starting on TRT, tapering off the sertraline, and just being their complete normal selves, if not better, and going on to achieve even better things. So yeah, it's something that we see in the UK as well, and it is definitely something that I think happens far too much, is that testosterone deficiency is misdiagnosed as depression, and we just feed into the issue by giving them a pill like this pill that. And I had it myself. I'm on TRT been about 4 years now, and it took me 9 months going back and forth to the GP, and I kept getting offered sertraline and Viagra. I was like, this is, and I said to them, I work in healthcare, this is a band-aid. You're putting a plaster on something. We're not looking for the problem. So it takes time. And if you're not either tenacious or strong in character, which these guys often aren't, they're broken, aren't they? They're really flat. Then you're not going to get what you need, because you're not pushing enough, because you're unwell and you're low. So yeah, it's something that we need to try and do what we're doing here, and educate the masses, and try and say, if it looks like depression, just have a little thing in your head that goes, could this not be depression? Could this be testosterone deficiency? Because I think an alarming level of them will be, and there's probably guys out there walking around on antidepressants for 20+ years that don't need to be.
Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.